Hello there. I'm Prashant Kadia, Medical Director of Interventional Endoscopy at Methodist Dallas Medical Center. And I want to speak to you a little bit today about acid reflux, or something we call in the medical community GERD, gastroesophageal reflux disease. Uh, what patients experience frequently, and what they call GERD symptoms or acid reflux, is really a burning sensation in their chest, the feeling of fluid or liquid, sour taste, acidic kind of fluid coming up from their stomach into their chest and sometimes even into their mouth, throat, and that they can taste it. And is very unpleasant and can cause a lot of discomfort and symptoms that reduce the quality of life for patients. Acid reflux has skyrocketed in the United States over the last couple of decades, and almost 1 in 4 to 1 in 5 Americans actually suffer with this disease. And a lot of it has to be related to the obesity epidemic. As obesity rates are rising, so does it concur with the rise in acid reflux rates. And often, patients will manage this reflux on their own over time. They get a little heartburn after eating meals. They'll pop some over-the-counter antacids, or try to treat this with home remedies and just kind of move on. And if it's not very serious symptoms or not very frequent symptoms, many patients will be able to manage this at home. But once the symptoms start becoming more frequent, more affecting their quality of life, and more bothersome, troublesome, that they need to speak to a doctor about it because over-the-counter medicines or home remedies or changing their diet doesn't work. This is really where a gastroenterologist can be useful for helping diagnose and treat this disease. The reason that acid reflux is important to recognize and treat is that if it is left untreated over time, it can lead to complications in the esophagus. So you can imagine that acid is made in the stomach and it's not supposed to reflux up into the esophagus. And if it does, if you have chronic acid coming into a place where it's not supposed to be, it can cause damage to that organ. So chronic acid exposure to the esophagus can lead to complications: inflammation, ulcers, bleeding, blockages or strictures, and even cancers of the esophagus. So this is why we don't want acid reflux to go untreated in patients. And so there are a lot of treatments that doctors that can help with in terms of diagnosing and treating acid reflux. One of the basic things we can do is adjust diet, work on weight loss, even medications, prescription strength medications to affect acid reflux. And if those things don't work, then we can even take a look down the esophagus with a camera called an endoscope to see if there's some complications of the acid reflux occurring, or is there anything that's contributing to a patient developing acid reflux, like a hernia. A hernia is when the stomach is slipping up into the chest where it's not supposed to be, and it causes the acid to come up. So there's lots of things that can be done to help patients manage and treat their acid reflux. There are even new endoscopic procedures to potentially cure acid reflux if we can tighten the junction between the esophagus and stomach and prevent the acid from coming up, along with surgical interventions that are already out there. So I think it's very important for population and people to understand that acid reflux is very common, but over time, if it persists, can be dangerous as well, and it shouldn't be ignored. So we're always happy to help you with this problem. If you do, please reach out to us, and we're happy to assess you for your acid reflux issues. Thank you.